About $200,000 in grants will be doled out over the next year across Connecticut. One of the projects from those grants will be based right here in Manchester as a pop-up mobile clinic for LGBTQ+ medical care. And that's for those communities who may not always be able to make it out to cities like Hartford or New Haven. According to researchers at West Virginia University, one of the biggest barriers for the LGBTQ+ community when it comes to healthcare is transportation, especially from rural communities who struggle to have enough trained medical professionals to begin with. And this can leave those same communities vulnerable, according to Kate Piotrowski with the Hartford Foundation for Public Giving.
LGBTQ+ adults are more than 2 times likely to experience depression, then they're also a little bit more than 2 times less likely to seek out necessary healthcare services. This is usually due to increased rates of discrimination in receiving healthcare.
But 2 years of work will soon pay off. A collective $200,000 in grant money will go towards 8 different organizations to help expand gender-affirming care, HIV testing, and mental health services across the state. Some of that money will support a mobile pop-up clinic housed at the Health Collective East in Manchester. And that could also shine a new light on the needs of rural health care.
They want to understand their access to populations to be served.
For a lot of queer individuals, sometimes if they live in rural communities, they don't have as ready access. Is that really what prompted you guys to go towards that pop-up clinic?
Yeah, absolutely. We do tend to see a lot of programs and services in more densely populated areas, certainly in urban centers. And while Manchester isn't exactly a rural town, it was a project that was submitted that we thought did address the needs of the LGBTQ+ community on the other side of the river, so to speak.
And in a time where the future of LGBTQ+ rights continue to be a source of discussion for lawmakers, Piotrowski hopes these projects will offer a glimmer of hope to those who look for it.
There's many allies and there's a lot of support throughout the region, and that's something definitely to lean into despite, what we may be hearing otherwise.
Piotrowski tells me we could start to see these projects start over the coming month, with the pop-up clinic itself starting services in September this year. In Manchester, Stephen Reels, Fox 61.